How we doing, guys? It's Jesse with the Common Man, Corpus Christi, and I've got a story from the Atlantic, of all places, that I wanted to share with you. So I don't think this is the first time I've covered an Atlantic story, so apparently somebody over there hasn't completely lost their mind. So this is actually, I think, some positive news in our lovely little pandemic with the coof that we're dealing with right now, as so many people on the internet like to call it. So let's just get right into it. Check this out. The Atlantic. Our most reliable pandemic number is losing meaning. A new study suggests that almost half of those hospitalized with COVID-19 have mild or asymptomatic cases. By David Zweig. I'm probably pronouncing that wrong. Sorry, David. September 13th, 2021. At least 12,000 Americans have already died from COVID-19 this month, as the country inches through its latest surge in cases. But another worrying statistic is often cited to depict the dangers of this moment. The number of patients hospitalized with COVID-19 in the United States right now is as high as it's been since the beginning of February. And actually, if you look at the numbers from last August, we're way higher. Anyway, it's even worse in certain places. Some states, including Arkansas and Oregon, recently saw their COVID hospitalizations rise to higher levels than any prior stage of the pandemic. But how much do those latter figures really tell us? From the start, COVID hospitalizations have served as a vital metric for tracking the risks posed by the disease. Last winter, this magazine described it as the most reliable pandemic number, while Vox quoted the cardiologist Eric Topol as saying it's the best indicator of where we are. On the one hand, death counts offer finality, but they're a lagging signal and don't account for people who suffered from significant illness but survived. Fair. Case counts, on the other hand, depend on which and how many people have gotten tested, which there's a lot of people who are asymptomatic, walking around, not spreading the disease, and not showing any symptoms either, and they could already have antibodies. There was a study that just came out from the CDC that was done back in May that said 80% of people in the United States have some version of, at least to some certain degree of immunity, because they've been exposed to the virus at least at some level since this stuff began. So that's something interesting to think about too. So presumably hospitalization numbers provided a more stable and reliable gauge of the pandemic's true toll in terms of severe disease. But a new nationwide study of hospitalizations records released as a preprint today, not yet formally peer-reviewed, suggests that meaning of this gauge can easily be misinterpreted, and that has been shifting over time. If you want to make sense of the COVID hospitalizations at any given time, you need to know how sick each patient actually is. Until now, that's been almost impossible to suss out. The federal government requires hospitalizations to report every patient who tests positive for COVID. Yet the overall tallies of COVID hospitalizations, made available on various state and federal dashboards and widely reported on by the media, do not differentiate based on severity of illness. Some patients need extensive medical intervention, such as getting intubated. Others require supplemental oxygen or administration of the steroid dexamethasone. But there are many COVID patients in the hospital with fairly mild symptoms, too, who have been admitted for further observation on account of their comorbidities, or because they reported feeling short of breath, i.e. their diabetes, their heart issues, like any of that kind of stuff that would cause you to be more likely to die with COVID than you were if you got COVID and didn't have one of those issues. The data has basically supported that since the very beginning. Another portion of the patients in this tally are in the hospital for something unrelated to COVID and discovered that they were infected only because they were tested upon admission. How many patients fall into this category has been topic of much speculation, right? Yeah, I like this one. Let me repeat that for you. Another portion of the patients in this tally, in the hospital tally for COVID hospitalizations, another portion of the patients in this tally are in the hospital for something unrelated to COVID and discovered that they were infected only because they were tested upon admission. Does everybody understand what that means? That means that you went to the hospital for a heart attack or for your diabetes or for a million other things. And just because you tested positive with COVID upon admission to the hospital, they are considering that a hospitalization with COVID. which, what would that do? It cranks up the numbers. Okay, they're not always necessarily in the hospital, not necessarily in the hospital because of COVID, but they're in the hospital and then got tested for COVID. Now, the real question is, does anybody differentiate with that? Or are we going to have to go into all the medical records individually to figure that out? I bet it's probably the latter. Okay? Another discovered that they were infected only by a tested upon admission. How many patients fall into each category, like I said, has been a topic of much speculation. In August, researchers from Harvard Medical School, Tufts Medical Center, and the Veterans Affairs Health System decided to find out. Researchers have tried to get at similar questions before. For 2 separate studies published in May, doctors in California read through several hundred charts of pediatric patients, one by one, to figure out why exactly each COVID-positive child has been admitted to the hospital. Did they need treatment for COVID, or was there some other reason for admission, like cancer treatment or a psychiatric episode? And the COVID diagnosis was merely incidental. According to the researchers, 40 to 45% of the hospitalizations that they were examined were for patients in the latter group. So 40 to 45% of the hospitalizations with COVID are because they were in there for something else. And that's just in the kids. The authors of this paper out this week took a different track to answer a similar question, this time for adults. Instead of meticulously looking at why a few hundred patients were admitted to a pair of hospitals, they analyzed the electronic records for nearly 50,000 COVID hospital admissions and the more than 100 VA hospitals across the country. Then they checked to see whether each patient required supplemental oxygen or had a blood oxygen level below 94%. The later criterion is based on the National Institute of Health of definition of severe COVID. If either of these conditions was met, the authors classified that patient as having a moderate to severe disease. Otherwise, that case was considered mild or asymptomatic. The study found that from March 2020 through early January 2021, before vaccination was widespread and before the Delta variant had arrived, the proportion of patients with mild or asymptomatic disease was 36%. From mid-January through the end of June 2021, however, that number rose to 48%. In other words, the study suggests that roughly half of all the hospitalized patients showing up on COVID data dashboards in 2021 may have been admitted for another reason entirely or only had a mild presentation of the disease. This increase was even bigger for vaccinated hospital patients, of whom 57% had mild or asymptomatic disease. But unvaccinated patients have also been showing up with less severe symptoms on average than earlier in the pandemic. The study finds that 45% of their cases were mild or asymptomatic since January 21st. Okay, let's stop right there and look at that. 45% of their cases were mild or asymptomatic since January 2021. That means before, or at least right after, the vaccine was widely available. Not commenting, just saying. According to Shira Doran, an infectious disease physician and hospital epidemiologist at Tufts Medical Center in Boston and one of the study's co-authors, and the latter finding may be explained by the fact that unvaccinated patients in the vaccine era tend to be a younger cohort who are less vulnerable to COVID and may be more likely to have been infected in the past, like we've been saying from the beginning. Although the limitations of the study in the patients in the VA system are not representative of the U.S. population as a whole, as they include few women and no children, no crap. Still, the findings echo those from the 2 pediatric admissions studies. Also, like many medical centers, the VA has a policy to test every inpatient for COVID, but this is not a universal practice. Lastly, most of the data, even from the patients admitted in 2021, derived from the phase of the pandemic before Delta became widespread, and it's possible that the ratios have changed in recent months. The study did run through January 30th, however, when the Delta wave was about to break, and it did not find the proportions of patients with moderate to severe respiratory distress was trending upward at the observation period. So Delta doesn't seem, well, at least from this study, doesn't seem like it made a difference at the end. The idea behind the study and what it investigates is important, says Graham Snyder, the medical director of infection prevention and hospital epidemiology at the University of Pittsburgh Medical Center. though he told me that it would benefit from a little more detail and nuance beyond oxygenation status. All right, I'm going to stop right here just for one of my own pet peeves. Okay, I used to write a newsletter for my local union, and this crap right here, where you separate Graham and Snyder, you intentionally never ever do that because it screws up the flow of the way you read that. So see how I screwed up when I read that and I stopped between Graham and Snyder? That's exactly why you're not supposed to do that in a news article. Right here. I'll highlight it right here. That right there. You're not supposed to break up a name. Anyway, I digress. But Daniel Griffin, an infectious disease specialist at the Columbia University, told me that using other metrics for severity of illness, such as intensive care admissions, presents different limitations. For one thing, different hospitals use different criteria for admitting patients to ICU. True. One of the important implications of the study, these experts say, is that when the introductions of vaccines strongly coordinates with a greater share of COVID hospital patients having mild or asymptomatic disease. It's underreported how well the vaccine makes your life better, how much less sick you are likely to be and less sick even if hospitalized, Snyder said. That's the gem in this study. People ask me, why am I getting vaccinated if I just end up in the hospital anyway? This is going to be more of the same vaccine stuff. You'll end up leaving the hospital, he explained, which 99% of people do, especially if you're under 50 and no comorbidities. CDC stats, don't ping me for that one. But I say you'll end up leaving the hospitals. He explained that some COVID patients are in for soft hospitalizations where they need only minimally treatment and leave relatively quickly. Others may, on the arrival of the drug, remdesivir for 5 days with a tube down their throat. Yeah, still says minimal. One of the values of the study says it helps the public understand the distinction and the fact that not all COVID hospitalizations are the same. Exactly. But the study also demonstrates that hospitalization rates for COVID, as cited by journalists and policymakers, can be or misleading, if not considered carefully. Clearly, many patients right now are seriously ill. We also know that overcrowding of hospitals by COVID patients with even mild illness can have negative implications for patients in need of other care. At the same time, the study suggests that COVID hospitalizations tallies can't be taken as a simple measure of the prevalence of a severe or even moderate disease, because they might inflate the true numbers by a factor or two. As we look to shift from case hospitalizations as a metric to drive policy and assess the level of risk to a community, state, or country, Doran told me, referring to decisions about school closures, business restrictions, mask requirements, and so on. We should refine the definition of hospitalizations. Those patients who are with rather than from COVID don't belong in the metric. Ping! It's the only reason I want to get to that last line, because that is exactly it. They are inflating the numbers, and I put money on it. It's not accidental. You know, they say with bureaucracy, never attribute to malice what you can attribute to incompetence. I guess there's some small arguments for that at this point. I honestly don't think there are. I mean, it's been so long. Come on, guys, get your shit together. You know, I can't even get the numbers for breakthrough cases in my own county, in the state of Texas. In Nueces County, I cannot get the numbers for my breakthrough cases. And that's insane. That how hard is it to go, oh, have you been vaccinated before? When they test positive, it literally takes 5 seconds. And for the Nueces County health administrators to be able to say they can't pull that data, it's garbage. They won't. And I will be filing some Freedom of Information request acts with them. I think with Texas, I think it's the Sunshine Law or something like. Actually, no, that's not it. I can't remember. Sunshine Law is something in Florida. I can't remember what it's called, but Texas has the open records request just like everybody else. Actually, I think that's what it's called, is the open records request. So I will be trying to get those numbers, and I will share them with you on social media as much as I can if I get them. But I've asked several times, and by the definition of the way the open records requests work in the state of Texas, all I have to do is ask them, and they have to give it to me. There's no specific form. There's no specific format. I can literally write it on a napkin and hand it to them, and they have to give me the records. So I'll keep working on that and seeing if we can get through it and see what we can do. But yeah, this is good news. This is really, really good news. It means that even the people that are hospitalized, right, vaccinated or not, whatever it is, the people that are currently hospitalized right now are doing better than ever, okay? So whether that means, and I'm not a scientist, I'm not an expert, I don't know, I'm just a talking head on the internet sometimes. I wouldn't even call myself that. I'm a guy that just screams at a camera sometimes because it helps get this stuff out for me. It's therapy. My little hobby here is therapy. But this is good news, okay? That means whether it's from the vaccine, whether it's because the Delta variant's not as bad anymore, or as bad as the last one, which we don't know for sure yet, but you know, whether it's the therapeutics that we found that are helping people with this disease, whatever it is, Things are getting better. Stop living in fear from this stupid virus. We all live, we all die, we all get sick, and not all of us make it when we do. So do like Dr. Fauci said, 2019, go get some exercise, eat better, get your vitamins, and go out and live your life, guys. Things are getting better. Stop being in fear of the panic porn. Turn off the legacy media. Stop watching the 24-hour news cycle and go live your life. That's why I do these little videos. You can pay attention. You can watch something that's 15, 20 minutes long, and that gets you the news that I think is really important for the week. And you can go from there. I post a lot of stuff on my social media that I don't always make videos over. So keep up with that stuff. Go look at it. I try to put as much important information out there as I possibly can. And yes, Facebook will not show you my stuff. You're going to have to go out of your way and go to the page, The Common Man, Corpus Christi, and find the information for yourself. But other than that, go live your life, guys. Stop being scared. This is good news. And from the Atlantic of all places. Hey, any port in a storm, right? This is Jesse with The Common Man. Thanks, guys. Just a friendly reminder, guys, if you want to support the channel in any way you possibly can, go check out our Teespring store. We got a couple of neat little shirts over there. Nothing super fancy yet, but we're working on things. So if you got a chance, you got a little extra money, you want to order a t-shirt, really help out the channel. Thanks, guys.